Good morning, my dear students. Today we are going to learn about knee joint examination. This is the first video of 3 video series on knee joint examination, and this video is mainly for medical students who are awaiting their first clinical appointment. Aim of this video is to give you the general understanding on knee joint examination. As for any examination, you have to take a brief history, and that history will depend on the complaint of the patient. After the history, you have to move into examination of the knee joint. Again, the most important thing I want you to understand is, first, what you have to do is get the main steps of examination into your head before you concentrating on specific steps of examination. So you will first examine the patient in standing position, then you must make patient to walk. Then you will get the patient onto the sitting position to do certain steps of examination. So then you will get the patient onto supine position. After that, you have to follow the principles of orthopedic examination. It means first look, then feel. After that, move. Finally, you are going to do special tests. So if you can remember this sequence of knee joint examination, that will be more than enough for this video. Anyway, we'll move into details of knee joint examination. So you will begin with when the patient is in standing position, and you will be looking at the patient's knee joint from the front. Of course, you are looking for obvious deformities, swelling, or other features, but your main concern is genu valgus and genu varus deformity. Then you will be looking at the knee joint from the lateral aspect. Your main aim is to identify genu recurvatum and genu procavatum. Then you will move to the back of the patient, and you will be looking at the popliteal fossa. Your main aim is to identify swelling. You are looking for Baker's cyst, then any surgical scars, and then you may look for visible pulsations as popliteal arteries, known as the second commonest place for aneurysms. After that, you will have to ask the patient to walk. So you are looking for gait abnormalities. The most important findings at this step is antalgic gait and unstable gait, or knee giving away features. After that, you will get the patient into sitting position to do knee jerk and also patellar tracking. Then you will get the patient onto supine position, and you are going to complete your inspection. So you are going to look for swelling, masses, surgical scars, arthrotomy scars, arthroscopic scars, features of inflammation, obvious deformities. Then you will start your palpation. First by checking for warmth, then tenderness, and then you have to do 2 specific tests at this point. That is patellar tap and patellar shift. But you have to perform these 2 tests only if you detect significant swelling in the knee joint. After that, you have to move into move component of examination. You are mainly checking for flexion and extension of knee joint. But before that, you may reconfirm presence or absence of genu recavator. First you will check for active movements, then you will check for passive movements. After that you will check for power of both flexion and extension of the knee joint. Then you are going to check for strength and integrity of the quadriceps, where you are going to ask the patient to flex the hip to 45 degree and the knee to 90 degree and ask the patient to keep the leg in that position. And if there is any significant weakness or injury to quadriceps, patient will not be able to keep the leg in that position. Then you will get both knee joints symmetrically in 90 degree flexion and you will compare two knee joints to any differences. Your main aim is to identify sac, which is a feature of cruciate ligament injury. In this position, you are going to complete your palpation, where you are going to palpate all bony prominences and important attachments for defects and tenderness. So you will be palpating for tibial tuberosity, bony edges of the knee joint, two collateral ligaments with their attachments of the capsule, and also the area you get bursa. After the palpation, you are going to perform special tests for knee joint. First, anterior and posterior drawers to check for cruciate ligament integrity. Then you will be checking for medial and lateral collateral ligament injuries. You get the hip into 30 to 45 degree flexion and knee joint into 30 degree flexion to relax the tensor fasciae lata, and then you will be exerting force on distal leg against the collateral ligaments to identify any injury. Then you will be checking for cruciate ligaments again by Lachman test, and finally we are going to check for meniscal injuries by McMurray test or Apley's grinding test. In this way, we are going to finish your knee joint examination. The techniques of mentioned test will be described in our video number 2. Thank you.